is Crystal Moreno, and I want to take a few minutes to talk about COVID-19. It is very important that we all understand what it is, how it spreads, and most importantly, what we can do to protect ourselves and each other. So, I want to start off as talking about what exactly COVID-19 is. COVID-19 stands for Coronavirus Disease 2019. It is a disease caused by a novel coronavirus known as SARS-CoV-2, which is short for Severe Acute Respiratory Syndrome Coronavirus 2. This virus can trigger a wide spectrum of symptoms which vary from person to person. Some people might experience mild symptoms such as cough, fever, fatigue, or loss of taste and smell. Others might develop more severe conditions such as pneumonia, acute respiratory distress syndrome, which most people know it as ARDS, or other complications that require hospitalization and intense care. The severity of illness can depend on factors such as age, underlying health conditions, and the individual's immune system. If you have a really bad immune system, you can most likely be more affected by COVID-19. This virus was first identified in China in late 2019, and it rapidly spread across the globe, leading to a pandemic that has touched every corner of the world and changed our lives significantly. The World Health Organization declared it a pandemic in March 2020, and since then, it has had profound impacts on healthcare systems, economics, and societies over the whole world. Next, what I want to talk about is how does COVID-19 spread? The primary way COVID-19 spreads is through respiratory droplets or small particles produced when an infected person coughs, sneezes, talks, or even breathes near you. These droplets can travel through air and land in the mouth or nose, people who are nearby, or they can be inhaled directly into the lungs. The risk of transmissions is higher when people are close impacted and very close contact, especially in poorly ventilated indoor settings where the virus can linger the air for long periods. Another way it can spread, though less common, is by touching surface contaminated with virus than touching your face, particularly your eyes, your nose, or your mouth, such like a gym or somewhere you're going to eat with family or friends. The virus can survive on surfaces for very lengths of time, depending on the type of surface and environmental conditions. This is why hand hygiene is so critical in preventing the spread, like washing your hands, using sanitizer, and wearing masks outside can be very effective. What can we do to prevent the spread of COVID-19? There are several effective measures we can take to protect ourselves and others. First, practice good hygiene, which is very important, such as washing your hands, like I said, frequently with soap and water for at least 20 seconds, especially after being in a public place or after blowing your nose and coughing or sneezing. If soap and water are not available, use hand sanitizer that contains at least 60% of alcohol. Avoid touching your face, especially your nose and your eyes and your mouth. Anything around your face can make coronavirus spread easily through the body. Second, wear a mask when you're in public places, especially indoors, to reduce the spread of respiratory droplets. Make sure that mask covers your nose and your mouth properly and fits right against your face, so there's nothing going through the mask. Maintain physical distance from others. Ideally, people would like to have 6 feet apart. to minimize the risk of transmission. This is particularly important in crowded settings and indoor environments. Fourth, stay informed about the latest guidelines and recommendations from health authorities, such as Centers for Disease Control and Preventions and the World Health Organization. These organizations provide up-to-date information on the virus, its transmission, and it takes large measures to let you know what can be done to help you prevent getting COVID-19. Getting vaccinated when it's available to you is very important. Vaccines are a safe and effective way to protect yourself and reduce the risk of severe illness, hospitalization, and death. Finally, if you're feeling unwell, stay home and get tested to prevent further spread of the virus. Self-isolation and testing are essential steps in controlling outbreaks and protecting not just you, but also the community and the people around you. By understanding COVID-19 and consistently practicing these prevention measures, we can all play a critical role in protecting ourselves and our family and our community and just everybody around you. It's a collective effort that provides everyone's effort, and it can just prevent and help us from spreading it more and less deaths, and everybody just staying safe. Thanks for listening, and let's continue to stay safe and informed about the situation. Thank you for listening.